Hey everybody, it's Mayor Scott Conger talking today with Todd Lewis, and some of you may know who Todd is. I guess he was one of the first hospitalization cases of COVID-19 that we had at Jackson-Madison County General Hospital. And Todd, thanks so much for taking some time and talking with me today. And I guess we just want to kind of start off, take us back, walk us through, your experience of getting sick, I guess, and then kind of what led up to going to the hospital and everything that you experienced.
I've just been working at school, and I was the dean of student life at Chester County Junior High, and I had been not feeling well, and so I had actually I'm not feeling well as in the fact that I had taken my son to a regional 4-H speech in Tipton County. And we had gone there that night, and I woke up the next day and just wasn't feeling well, so I stayed home. I was at home for about 10 days, and that was kind of first when they had declared it a pandemic. I remember that they had just canceled, being a big sports fan, they had just canceled the SEC tournament, basketball tournament, and just kind of remember that. And I kind of basically laid in bed for about 10 days. I had gone to the doctor a couple times during that time. The last time that I went to the doctor, they tested me for COVID. They had just gotten the test. They tested me for it. Of course, I didn't receive my results till 4 days later. And on that fourth day was actually the day that I woke up and was having problems breathing. And I'm not one to go to the doctor unless I absolutely have to. And I woke up that morning and I told my wife that I think I needed to go to the ER. We called the ER and they said to go ahead and go to your general doctor. And so when we got to my general doctor, my wife said she could tell that their whole demeanor had changed. I guess just seeing me and how I came in and doing x-rays of my lungs and stuff. So they immediately sent me to Jackson General, let them know that I was coming. They had a CD with pictures of x-rays of my lungs and everything like that. So I was admitted that day, but of course, I think that's when Jackson General was they had just kind of closed down the hospital. And so my wife couldn't come in. And apparently I was texting her what all they were doing in the ER, although I don't remember that. There's a lot of stuff that I don't remember from those 10 days, even being sick at home before I went into the hospital. But I was texting her. She sat out in the parking lot for 4 hours because she couldn't come in and everything like that. So they admitted me, and that day they had me on I think it was 2 milliliters of oxygen. And then by that Saturday, that was on a Friday, by that Saturday, they had me at 5, and I think 6 is the max. And they tried 2 different, I think it was a high flow oxygen. Nothing was working. So I remember them coming in and telling me that I needed to go on a ventilator. This was going to be my best option. When I went back a week or so ago and got to see my nurses and doctors and stuff, they told me that I said I wasn't going on the ventilator, but they needed to call my wife. And so my wife said, yes, you are going on the ventilator. But at that time, my wife was under the impression that it was just to help me rest, and, that it wasn't like it was a big deal to her. And then she found out that it was a much bigger deal. And so I was in Jackson General for 14 days. I was in ICU on the ventilator for 8. And then I was 3 of those days I was in a medically induced coma where they had me on my belly for 16 hours a day and had me on my back for 8. And then so after those 8 days in ICU, and I got the ventilator taken out, and then I got to the COVID floor where I completed my recovery and everything like that, and then finally got to go home. So I was the very first patient in Jackson General with COVID-19, and then the first one to go home. And like I said, I don't remember a whole lot from ICU, obviously, with all the medication and everything like that. I remember more so when I got to the COVID floor. So I actually didn't know how bad I really was. I had no idea until the nurses were telling me when I was fully awake and off that medication.
Well, and so I guess my first really question about that, Todd, is you're not what we hear as the high risk category. You're not Yep, morbidly obese. You look like you're in pretty good shape. You're not 65 or older, I don't think. Um, and so I guess we hear that if you're not in those categories, if you're not at high risk, then it's like the flu or a bad cold.
No.
So I guess I guess address our time, talk to that a little bit. If just a bad cold, just a flu. If you're 38-year-old healthy guy, it's not going to affect you that bad.
Right. Like I said, when it happened to me, we didn't know much about it yet because it was first coming out. But yeah, I have no underlying health issues. But like I said, my only symptoms were a high fever and fatigue. And so, I'm thinking that I've got the flu or, something like that. And then when I go to the doctor and they test me for all that and they can't find anything, so I'm just kind of waiting in my house for it to take its course. And then it turns into, me not being able to breathe. And I've got the COVID pneumonia. I believe they said the stuff that was coming off my lungs looked like I was a COPD patient. And so, yeah, you say it's going to happen to the high risk, but you don't know. I mean, nobody knows. It seems like it takes a new twist and turn each day, and we learn more and more each day about different things about it. Post COVID-19, people are still having issues and stuff like that. I try not to read too many news articles, but I find myself doing it because I'm like, well, is this something that I'm gonna have to look at down the road, and everything? Is this something that's going to affect me? But yeah, I mean, you think it's going to affect the higher risk. Even we've talked about, affecting people that have asthma, underlying health conditions. My middle son actually tested positive for it, and he has asthma, and he had a fever of less than 100 for like a day, and that was it. So you've got somebody with underlying health issues, and then you got somebody completely healthy, and look what happened. It was the complete opposite. So you just don't know maybe what strain is it, what you're going to get with it. You don't know. You don't know how it's going to affect your body.
And so can you, I guess, talk about the recovery? Because obviously leaving the hospital, you weren't ready to go run a marathon. And so
Right.
what's the recovery been like from getting sick, being in the hospital, and coming out?
Well, I lost a total of about 20 pounds from those 10 days beforehand, and then all the way up until came home from the hospital. So I would say 24 days, and so I lost 20 pounds. When I came home, I mean, I was still wobbly, still tired and stuff like that. I actually would sit on my porch and watch my kids. That's all I wanted to do when I first came home, was sit and watch my boys play outside, watch them play basketball, run around, stuff like that. And so I did that, and I kind of sat on the porch and just did that for probably a week or so. And then, after I'd been home a couple of days, even walking up the stairs at our house, I got a little winded because I hadn't walked any stairs and everything like that. But slowly I started working back, and felt good. I mean, I've had no problems breathing or anything when I got home. It was just more or less those day-to-day activities, getting used to them again. My wife got mad at me. I'm OCD and a neat freak, and so I wanted to vacuum, and just after doing vacuuming, this was probably, I'd been home for 3 or 4 days, and I tried to vacuum and vacuum one area of the house, and I was already ready to lay down and everything like that. But slowly, my wife and I went, probably 3 weeks, 4 weeks after I'd been home, we went for a run, not at a marathon pace or anything like that. I think we did like a couch to 5K pace, and it was good. I felt good. I've run a half marathon before, so I felt good as I ran and had no problems breathing. I think the only thing that I've had is a little bit of the memory. Like I said, I don't remember a lot those 10 days beforehand, and even trying to recall things as I've been working back at school now, thinking about things that have happened this past year and stuff like that. Some of them, are hard to recall, and so I've noticed that's getting better. But at first it was a very slow process because I'm constantly trying to multitask and do a lot of different things. And I realized that I kind of had to slow down and work back into that and everything. But other than that, the recovery's been, nothing that's really set me back. So.
But we don't feel bad. I haven't had COVID. I still get out of breath when I do one room of vacuuming, so we got to lay down. Yeah, I think, too, unfortunately, through all this process, because it's a new virus, because we learn something every day, every week, the information evolves, the data evolves. It's left a lot of room for politics to get inserted into it, and you see that with us talking about wearing masks and protecting ourselves and protecting each other. And as someone who has been at the worst end of COVID-19 and come back, can you give us your thoughts on what we should do to protect ourselves and protect each other?
Well, I'm taking steps to protect myself and my family, and then our students as we start here in the fall. But my message has been: you lose nothing by wearing a mask and social distancing, but you can lose a whole lot more by writing this off as some political hoax or a media hype and doing nothing. I mean, we talk about doing things for our fellow man and everything like that. So I'm going to go out and I'm going to wear a mask. We went to dinner the other night, my wife and I did, to celebrate our anniversary, and I wore a mask into the restaurant until I started eating. And as soon as I got done eating, I put my mask back on, and we walked out. So you don't know what type of potential you could get if you get it. And so wearing a mask, I mean, I guess I just don't see the harm in it. I mean, I think about the healthcare workers. I think about these doctors and nurses that are having to wear it. Good grief. I mean, all day long in their shifts, they were coming into my room and, fully having to gown up, to come into my room, and then gown down, and they've got to wear the mask, and they've got to wear the shield, and their shield's fogging up if they're in a hot room and stuff like that. So, I mean, to wear a mask, for 15 minutes in Walmart, or, wear it until you eat at a restaurant or something like that. I just don't see how you could take the chance and say, hey, this is nothing, and everything like that, when you see what happened to me. That's just my perspective on it, so.
That's probably the best perspective there is, someone who's been through it. As kind of last question on a high note, I guess, you had the opportunity to go back to the floor and talk to the nurses and visit them, and kind of tell us about that.
It was great. Actually, I told one of my doctors on the COVID floor that I was going to come back and hold a sign out front, which I got to do earlier. But he told me, when I told him that the day that I was getting discharged, he said, I don't want to see you for 2 weeks out there. And of course, you had just made the stay-at-home order, so it made it easy for me not to be able to go out there. But I actually got to go during Nurse Appreciation Week and hold signs out there saying, thank you for saving my life, because, I mean, that's what they did. And I can't say enough about the doctors and nurses there. And, my family is just constantly praying for them, because I know when I got to go see them the other day, I can see the mental and the physical exhaustion from them. And I read each day of how the statistics of how many are in the hospital, how many are on vents, all that kind of stuff. And just constantly praying for those guys, because they're on the front lines. They're putting their lives at risk, to get us better, to save our lives. And so it was great just to see them. Of course, I still don't know what their face looks like. I can remember, I told my wife, she said, how will you know if you know them? I said, I'll remember the eyes. And so that was a great day to see them and tell them thank you, and hopefully lift their spirits up as they continue to have to do this day after day after day. It was a great feeling, and I got to ask some questions, because, like I said, I don't know if I dreamed things or if it was actually real. One of my nurses told me that I did, in fact, after I got off the ventilator, call and ask her for some peanut M&Ms. And she said, yes, you did do that. And she said, and I got to thinking, I was eating peanut M&Ms at the time. And she was like, can he see me? But there was like a little bit of shade between the window where I could see out there, and I obviously didn't see her. I just like peanut M&Ms, and so she
Wow.
thought that I had saw her eating the peanut M&Ms. But I said, "Did I actually ask that?" And she said, "Yes, you did." And I said, "Okay." So, but it was good just to see them and everything like that. And again, they thanked me for coming and thanking them, because not a lot of people do that. So I just appreciate everything that they did. And like I said, I can't say enough about Jackson General. It's a great hospital. So
Fantastic. Thanks so much for sharing. Is there anything, last words you want to share with anyone that may be watching?
now, just like I said before, you're going to lose nothing by wearing that mask and social distancing. But I wish I could send you a picture of me in the hospital, that they took while I was out and sent to my wife, and show you that that's what you can potentially be losing. As my wife said when we went on vacation afterwards, I was out in the ocean with my boys, and the waves were really knocking at my back. And I said, "Man," I said, "these waves are really, really killing." And she said, "Hey," she said, "it's better than being 6 feet under." And I said, "You're totally right, totally right." So that's the thing. Wear the mask, social distance, and take care of your family and the others around you.
That's great. Todd, thank you so much for taking some time to kind of share your experience and your thoughts on everything going on today. Appreciate
Glad,
it.
glad to do it, man. Glad to do it.